In terms of our panel this afternoon, or this afternoon is in the UK, of course, we've got this mix of everybody, right? So we've got all 10 levels of longevity in the mix here. So we're going to toggle around all sorts of questions and probably confuse a lot of people. But if I could just ask you, Deep, there was one last question that came in just at the back end of your presentation, which was the sort of traction that you've got now on your customers and the kind of growth of what you're doing. Because it's interesting, you're working with insurers, you're working with hospital institutions. So you're backing into potentially large volumes of lives under management. So can you share some of the numbers with us?
I won't go specifically into numbers, Phil, but what I'll share is the interest is across industries, across regions. The way we have built the tech is it's inexpensive because my vision is that, and I sincerely believe that biological age is a statistic that everybody on this planet should know. Like people know their weight and they know their height, they should know also their biological age. And we have priced it in a way which is really accessible. Now, along with that, I think what we have done is we have created bite-sized recommendations which are really easy to follow and actionable. So our target here is not people who have access to, let's say, specialized care and are getting very personalized advice. Even in that case, I think it is incredibly difficult and would take a lot of time for a physician or a group of physicians to put together a plan which is very specific, very personalized for every individual. It just take a lot of time. Now, if using AI, we can provide them a base which gives a level of personalization which works, and then they can fine tune it based on everything else. That is what we are seeing is very acceptable to our customers.
Okay. All right. Great. Well, let's move back into the realm of the science of longevity. Kevin, you obviously gave a presentation about your very big bet on the xenotherapeutic hypothesis of aging, right? So, what have you seen that gives you the confidence to pursue what you're doing clinically, as well as obviously looking for 100 million check?
Yes. I got into this field because I actually was an cellular immunotherapy physician. Originally was a surgeon, but then founded the first CAR T cell company before Kite and Juno, and took it public for $500 million or whatever at that time. And it was based on technologies that we had invented. We had an on switch and an off switch for T cells. It turns out that the off switch is based on inducible Cas-based technology. So there's a small molecule dimerizer that when you give it, it dimerizes Caspase-9 and causes the cell to undergo apoptosis within minutes. And we deployed it in T cell therapies. And so if a patient got a cellular therapy and everything went well, that's fine. But once in a while, things go haywire. There's a very bad side effect called ICANS, where you get neurotoxicity and it leads to death. But if you give a single dose, if the cells carry our off switch and you give a single dose of the dimerizer within 20 minutes, those cells are gone. And in every single case, it resolved the toxicity. So that was that company. Well, it turns out that Kirkland was using that technology, which we invented and owned, to create transgenic mice in which they expressed that off switch on a P16 promoter and then use the dimerizer to get rid of senescent cells in the body. And he made this P16 ink attack model and showed that all these diseases aging get reversed and mice live 25% longer and all these other great things. And then there was a host of other researchers who used that same model to ablate senescent cells and look at other things like bone health, like obesity, like glucose metabolism, exercise, and in every single case, they reversed the aging phenotype. And that's how I got into the field, since I owned this technology and the when I looked at all the things you could do for aging, that had the most proof of concept solid for me. I'm a scientist. I've published extensively in prostate cancer, so I know good science when I see it. So that's how I got into the field. And so we started developing a gene therapy to target that to senescent cells and eliminate them. And then while I was doing that, by accident, I came across a class of peptides that's very effective at eliminating senescent cells. I haven't seen any toxicity yet after 14 or 15 weeks of continuous therapy. And we don't really think you need more than, let's say, 8 to 10 weeks to do the job. So that's how I got into this field. And it seems very, very de-risked. The science is so strong.
Mm-hmm.
And, it's like when I treated our mice with peptides and I saw that bone health improve, bone mass went up. I wasn't surprised because somebody else used the same model I just referred to and did it before. So that's how I got into it. Now, so I feel it's de-risked. I feel that this is a type of therapy that everybody can understand. It's we're not targeting, molecules in the cell that are critical for other things. And I feel like if I put the right team together, this is a real opportunity to get into the clinic with a type of xenotherapeutic. I don't really see any other good. I looked at all the clinical trials being done in this field. It's mostly dasatinib and quercetin and fisetin. There's really not much. There's just a few. So anyway, that's a long-winded answer, but basically we're going in big.
Yeah. So you're going big on xenotherapeutics, and of course that, I guess, is the gateway to the concept of perhaps systemic rejuvenation at a certain point. Greg, obviously this is not your first rodeo, right? So you've built and successfully exited some pharmaceutical companies. So there are these concepts of, do you go disease focused and you kind of go one step at a time, and then obviously spread your portfolio once the science maybe it's protected from a big pharma absorbing it and putting stuff in the back office like Raiders of the Lost Ark, or is there an opportunity for companies to be able to take what they're doing now and expand and accelerate quickly, like we've seen in the concepts of the GLP-1s moving into cardioprotective therapies and neuroprotective?
I don't think there's a perfect model. I think it's, very much based on whether you have a platform technology. To me, the way I look at it, and for the investors on the call, this is an odds game. 90% of drugs fail, and different stages have very different metrics. The one that really resonated with me and has led to my good fortune in having two of the top 10 biggest biotech exits in the last decade with Medivation and Biohaven is to create a portfolio of 7 to 10 drugs and that are non-correlated, and then just try to be right on one. And that's based on an 8-year retrospective study that said your chance of having a successful proof of concept is 22 to 54%. 54% for antibiotics and insulin because they worked in phase 1, they're going to work in phase 2. 22% for oncology and autoimmune. Oncology because cancer is such an erratic path. So your therapy they may be on placebo, but they just go into remission. Yeah. And autoimmune because of the sugar pills. So I felt that I could probably, and my colleagues and partners, Declan and Jim, felt we could probably rewrite 1 and 3, and the nice thing is you get it right, you get a 15 to 30x return just on that proof of concept, let alone taking it to market. So just going from successful phase 2 to say phase 3, and I always tell people, just to put it in context for you, the investors, how long would you play at a table in Monaco or Vegas if 1 out of every 3 times you won 30 times your money? But you can't play once because you have a 66% chance of failure. So to circle back to your question, one, I think that, it's very important you either have the ability to create the portfolio of the investments you do. Alternatively, you find a great management team that has a portfolio, or you have a platform technology like the GLP-1 where you can continue to add. But that's still a huge binary because it could still fail on its phase 1 and then you're back to 0. So again, modify your portfolio accordingly if you have those binary events.
Now, Greg, we had a question which is a very direct question, and again, feel free if this is not appropriate, but one of your investors, who's a Portage investor, is saying, is there a plan to reshuffle some of the companies that are in your and Jim Mellon's portfolio with Serena and Portage at low cash, and of course, Ajax and so on? So there's quite a lot of complexity there, so I don't know what the nuances of all of that may be.
No, each one is an independent entity. They've got different shareholders. You're trying to maximize the opportunity for all your shareholders. So working very aggressively on all of them to maximize. And as we talked about, we've gone through a biotech winter torturous to try and raise money. But I think things are changing. And, so I'm very excited to go into the future with all three of those assets and no reshuffling.
Right. Okay. Got it. So another question that came in, and please, everybody, please let us have your questions because I've got a bunch of questions, but I'm sure yours are more interesting. So one came in from Jason Young, which is a bit of a sort of panel question, I guess, and I think feel free to jump in. It's saying that if aging's a burning house, how much attention or interest and resources are organizations actually putting into solving the core problem, right? So I guess what we're saying is that effectively aging is the problem. Is this resonating with people still? I mean, are we kidding ourselves? Are we in this longevity echo chamber that really, actually, on the outside world, people are just still focused on fixing diseases? Or are we, in the interactions that you're having with investors, are you seeing a sea change in the way that people are looking at this whole sector? Please, anybody.
I've been very pleasantly surprised that big pharma, who are the Titanic when they're trying to turn, are embracing prevention. And I think the GLP-1s, just to circle back to that, and the Ozempics, Mounjaro, have done an amazing job of showing just how big this opportunity is. Novo Nordisk, it's second biggest company in Europe, based on one product like that. So I think that the industry has listened and heard the sounds of change. So yes, I think that there is a big difference on that. Now, to the second part, do we have any reason to believe that we can live through 125 or 150? A couple of people have mentioned that, we have not got something right now. I would disagree with them. As I said, the GLP-1s are the first anti-aging drug, not because they are changing cellular aging, but because they're limiting diseases unless you're living longer, which is the equally great outcome I think all of us would be very happy with. So how long? Don't know. And maybe we're kidding ourselves. There's lots of people who think we can live to 1,000. And that is certainly an argument. Over to you, Kevin.
Well, I'd like to add one thing there. When Steve Jobs was developing the iPhone, he was famously asked, well, are you asking, consumers whether they want an iPhone? He goes, well, why would I do that? I'm just going to give them an iPhone. And then once they put it in their hand, they'll never put it down. And that's what happened. If you build it, they will come. So, my view is that we can talk a lot about this on webinars and all this other stuff. But, when we have a therapeutic that can move the needle by affecting aging in some significant way, I'm betting on Senolytics, but, there's other possible ways that would work. But when somebody has something that is looking like a GLP-1, that is, they went after diabetes and then they said, oh my God, it also causes weight loss. And then they did that and they said, oh my God, it also does all those other things. In other words, that industry happened by accident. It wasn't like Big Pharma went out to create GLP-1s. It just happened. It's just the way the iPhone happened. And hopefully just the way senolytic peptides will happen or something else. So I'm just going to do it the way I see it. Because I did it once before. I created the first CAR T-cell company. For 10 years, people told me I was wasting my time, that immunotherapy would never play any role in cancer therapy. Well, they were wrong. So, I follow the science, and I think the rest of the people on the panel are doing the same. They have, founders have to have belief. Everybody on this panel has a belief in what they're doing and pursuing it for the right reasons. And as was said, if you can just be right on 1 out of 10 of your ideas, you'll be successful. So that's how I look at it.
All right, all on red, right? That's great. So let's talk about ultra high net worths, okay? Because I guess that I was hearing from you, Greg. That's where you're getting a lot of traction from investors. I've been speaking with some ultra high net worths who are concerned that the progression of these therapeutics is still taking too long, and they are thinking about more extreme ways of enjoying their wealth for as long as they possibly can. Emil, you're working with a lot of these people as well, I would imagine. So in terms of the when, right? I mean, I guess this is the question that everybody's trying to answer really at the moment, which is we're seeing all this great science, we're seeing it progressing through clinical phases, it's getting, closer one day to an approved drug. Swiss Re think it's still 30 years away. Do you guys, based on that optimism that you've got, does anybody have an opinion on how far away we are now from the likes of an aging therapeutic that's going to be a blockbuster like a GLP-1? 5.
5 years,
Right.
5 to 7.
Yeah, I agree. I agree.
All right.
Basically, the way I see this, the way we're playing it out is we're going to go after 3 different indications and 3 different populations with a standard FDA looking trial with a primary endpoint. But then we're going to synchronize the secondary endpoints across all the trials. And if we just, so we just on the timeline of a regular trial, we'll have 3 different results. And if any of them look good, plus if the secondary endpoints all sort of start showing that it's a gerotherapeutic, not just a disease therapeutic, the FDA will have to notice it. I mean, I brought on Jody Aiken, who took the TAVR to approval, and when she started, everybody was doing cardiac surgery, and now nobody does it anymore. They all use TAVR, so it can happen. It can be done. It didn't take her forever.
Okay. So, Emil, is that a flaw in your business model that all these therapeutics are going to suddenly happen in 5 years' time?
I mean, I'm not sure if the rest of the panel talks about maximum lifespan here, right? I mean, blockbuster drugs don't need to necessarily change maximum lifespan to be blockbuster drugs, right? Or anything even close to it. If anybody wants to bet that there's any drug that changes maximum lifespan in 5 years, I'm more than happy to take that bet. I wouldn't work on cryopreservation. Like, don't get me wrong. I hope you're right, right? I don't want to be right. I just much rather take whatever drug there will be around. Cryopreservation only makes sense if everything else didn't work, right? It's not a great solution. It's just the last ditch effort.
I live in Miami because I like to be warm. The idea of cryopreservation, it makes me a little shivery.
I would jump in your ice bath.
I agree. I agree.
Yeah.
I
think heat shock protein.
No, I think the trick is to think of the alternative.
Permission or cryo, right? I mean, why not go cryo?
I think that's unfortunately how you need to think about it, because otherwise I would very much agree with you.
Okay. So we're kind of touching around the concept of 2 aspects to longevity and health span, and I'm sure some of you will be aware of the paper that was published in Nature Aging, which was saying that human beings will never get past 125 years old, right? Just impossible. And I had a conversation with Eric Verdin, who kind of on social media was supporting the fact that we need to be more realistic about talking health span and lowering our expectations. And I guess that there's this argument in the industry, isn't there, about, okay, when is it going to happen and how amazing is it going to be when it gets here? So, of course, fixing multiple diseases of aging at the same time, those are building blocks. These concepts of systemic rejuvenation, we heard from Daniel earlier, which is, again, this kind of potential, this unbelievable potential of taking every cell in the body and returning it to its younger state. And I guess that's kind of an interesting aspect to the industry. So do you feel that the dialogue is mature enough in our industry for people to take this seriously when you're in front of investors, or people still thinking that this is a little wacko?
I think that unlimited, living to 1,000, I had a very animated discussion once upon a time with Aubrey de Grey. He said you're going to have escape velocity, and everyone's going to live to 1,000. And, I said, that's nice, but if we don't solve Alzheimer's and, the fact that I hurt my knee skiing and now I can't get up, nobody's going to want to do it. There's so many major issues that have to be resolved before we'll get there. Yeah. To Emil's point, whether I personally think 125. So, that's a meaningful change if you're healthy until then, which would be fantastic. Beyond that, I don't know. I know, Kurzweil talks about us having a wet body or a dry body. So there's all sorts of variables in this equation. But I think that we'll add in the 5 years, 7 years was not, immortality. It was 10 more healthy years, which, by the way, doing what Deepankar is doing, just helping people with their lifestyle changes, but probably had 4 or 5 years.
Yeah. And I guess that's, you helped me out there, Greg, because I was going to pull deep into the next phase of this conversation, which is, I've heard that, insurance companies, albeit that if they're pension companies, they don't want this, right? If they're life insurance companies, they want it. But I have heard that institutions are starting to consider hedging the concept of longevity, that obviously they've got a portfolio risk as it is now, so they can rebalance that portfolio risk by investing in some of these companies. So I guess the question I had for you, Deep, was, you're talking with insurance companies. We are aware of this specter, whether it's a good thing or not, that biological chronological age is coming into the insurance industry. So can you tell us what you're experiencing when you're speaking to these firms?
Yeah, absolutely, Phil. So I'll just take comment on one point which was discussed before. See, our approach is a pick and shovel approach to longevity, right? And what we are trying to say here is, like, we want to partner with everyone, right? We have built technology that is essentially, so when someone says, he's doing that, I don't see anybody in the industry who is like my competition. I think I can partner with everyone, right? If you are doing clinical trials, then potentially you would like to use our biological age clocks as an important statistic. And if Emil is looking for people to join, then he would definitely like to motivate them by telling them that, their biological age is more, and then they should be taking care. Insurance companies have regulations. So even though they want to do quite a few things, they can't. Even though they would want to come up with personalized products, they can't. They can't issue policies to select people in the population. Then all the insurance companies would want to just have the healthy population with them, and nobody would insure people who have disease conditions. So they have inherently a lot of restrictions in terms of what they can do. I've spoken to insurance companies who have told us that we have built in-house models which can predict mortality and do a lot of other things because we have so much data, but we really can't action on that.
Mm-hmm.
What we are trying to tell them is you can use longevity to really engage with your customers, right? Once you have insured them and you want to then address your bottom line, it is in your interest to keep them healthy. And if you do that, then it works for you, right? And then, please go ahead.
I was just going to answer what Phil had said before. Phil, were you referring to Jay Olshansky's paper? Because I've been talking to him a little bit about that. So
yes, I was.
Basically, what he said was that all the increase in average lifespan over the past 100, 200 years was because we were just improving simple things like, washing your hands, food safety, all that stuff, and that anything now in the future would require some kind of a major advance in something fundamental. And actually, I was showing him some of our data, and he thought that, xenotherapeutics would be a potential candidate that could change what he said, which is, he said, now based on current, go ahead.
To interrupt you, Kevin, I think it's for the benefit of our audience. But basically, what it was, it's like a 30-year study of a retrospective study of population, age, interventions, and it was in the rearview mirror, right? So what you're saying is that these types of papers are great. They help debate, but likewise, they're not taking account of what's going forward. So we're all optimists on this call, right? A lot of our audience are optimists. So really what you're saying is that we're waiting for these breakthroughs, right? And xenotherapeutics could be one of those. Celery programming could be another. And I mean, I guess I don't really know that there's any others that I could say that have that kind of level of hope behind them that I'm seeing in the industry from that systemic perspective.
Right. Until you change the world, nobody sees it coming. Most of the experts never really saw the next big thing until it passed them by, because, who would? It's human nature, to be, not to be able to do that. So I think, I agree. I do think it's 5, maybe 7 years away till we'll have a major advance. And, 35 years is really a pessimistic view. If that's the case, that would be sad.
Yeah,
well, if they're in the reinsurance business, they're in for a shock.
Yeah, so I mean, I guess the thing is that institutional investors, which there may be a few on today's call, I guess there's a whole mixture of individuals as well as institutions. Greg, you were doing the rounds, right? I can remember when you guys were speaking with Bank of America and stuff back when I first started meeting with you guys. I mean, do you feel that they're getting it yet, or are they still outliers?
No, I think the banks are way ahead of the investors.
Really?
Bank of America said that it's going to be $500 billion industry in like 3 years. McKinsey said it's going to be $1 trillion by the end of the decade, 2030. Citibank, Yigal said that this is one of the top 10 biggest, transformative technologies of this decade. So they get it. and they're very watchful. And by the way, I went in, we met, Jim Mellon introduced us to an a pension fund, and they were as hip as we were. I mean, like their science back, they had it all. They knew what was going on all the way through longevity, this pension company. So they're on to this. They're watching it very, very closely. And they talked about, the fact that investing in us might be an arbitrage on their pension. So no, it's happening. And so now we have to catch up. We need a couple of successes, to get everybody incredibly excited about the sector. And I still think, Emil, there's going to be a business for you, because I'm not convinced anytime soon we're going through 200. So people still may want to do the cryotherapy, and then also obviously they need to work on their lifestyles as well, because a lot of us are shooting ourselves in the foot with what we do.
Yep, as do we all. And I guess from our audience's perspective, I wanted to thank you all really for your presentations, which were great, as likewise this panel session. Of course, it always feels a bit truncated when these conversations really start juicing up. They've actually got to wrap things up. So I'm so sorry that we can't continue, but thank you so much to the panel. It's been great. And thank you, of course, to our audience for joining us today. And of course, thanks very much to the Master Investor team who've done a great job of putting all of this together and bringing it into a very, very seamless webinar.